Hello and welcome to our channel. In this video we will discuss about neuralgia, and basically in this video we will mainly focus on what is post-herpetic neuralgia. And the topics which we will cover in this video are: what is neuralgia, what are the various types of neuralgia, about what is the basic etiology of neuralgia, that is, what are the causes that leads to this condition called neuralgia. Then after that we will discuss about post-herpetic neuralgia in an elaborated manner in brief. After that we will discuss about the clinical features of post-herpetic neuralgia, that what are the signs and symptoms of post-herpetic neuralgia, and after that we will discuss about the diagnosis and investigations, that what are the various tests which you can perform if you are suffering from post-herpetic neuralgia in order to diagnose. Lastly, we will discuss about very important part, that is the management. How will you manage if you are suffering from post-herpetic neuralgia or you are suffering from any type of neuralgia? So that we will discuss about. So these are the basic topics which we will cover in this video of neuralgia. So first of all, we'll talk about what is neuralgia. So neuralgia is a stabbing and burning and often severe pain due to an irritated and a damaged nerve, and the nerve may be anywhere in the body, and the damage may be caused by several things including aging or disease such as diabetes mellitus or multiple sclerosis or any kind of infection such as shingles. So this is the basic definition of neuralgia. Now next we'll discuss about what are the various types of neuralgia. So as you can see here on the screen, basically there are three types of neuralgia. First, that is post-herpetic neuralgia, second trigeminal neuralgia, and third one is glossopharyngeal neuralgia. Now one by one we will talk about them. So first of all we will discuss about the first type of neuralgia, that is post-herpetic neuralgia. So what is post-herpetic neuralgia, that we will discuss now. So this type of neuralgia occurs as a complication of the shingles and may be anywhere on the body. Shingles basically is a viral infection which is caused by a painful rash and a blister on your body, and this type of neuralgia can occur wherever the outbreak of shingles was, and the pain can be mild or severe or persistent or intermittent. It can also last for months or years. In some cases the pain may occur before the rash, and it will always occur along the path of a nerve, and it's usually isolated to one of the side of the body. So this was all about the first type of neuralgia, that is post-herpetic neuralgia, and later on we will discuss it in an elaborated manner. Now let's talk about the second type of neuralgia, that is trigeminal neuralgia. So this type of neuralgia is associated with the pain from the trigeminal nerve on your face, which travels from the brain and branches to different parts of the face. The pain can be caused by a blood vessels pressing down on the nerve where it meets with the brain. It can also be caused by multiple sclerosis. Now let's talk about the third type of neuralgia, that is glossopharyngeal neuralgia. So in glossopharyngeal neuralgia, pain from the glossopharyngeal nerve is associated here, which is in a throat and is not very common. This type of neuralgia produces pain in the neck and the throat. So these are the basic three types of neuralgia, that is post-herpetic neuralgia, trigeminal neuralgia, and the third one is glossopharyngeal neuralgia. Now next we'll talk about the etiology, that what are the basic causes that leads to neuralgia. So Let's talk about the causes here. So the causes of some type of nerve pain is not completely understood. You may feel nerve pain from damage or any type of trauma, or you can say injury to a nerve, pressure on a nerve, or changes in the way the nerve functions. First and the foremost cause of neuralgia is infection. An infection can affect your nerves. For example, the cause of post-herpetic neuralgia is shingles, which is a type of an infection which is caused by chickenpox virus. The likelihood of having this infection increases with age. An infection is a specific part of the body which may also affect a nearby nerve. For example, if you have an infection in tooth, it may affect the nerve and causes pain. Now the second cause of neuralgia is multiple sclerosis. So multiple sclerosis is a disease which is caused by deterioration of the multiple sclerosis. Now the third cause of neuralgia is pressure on nerves. So pressure or any kind of compression on nerves may cause neuralgia, and the pressure may comes as from bone, ligament, blood vessel, or any kind of tumor. The pressure of swollen blood vessels is a common cause of trigeminal neuralgia. And the next cause of neuralgia is diabetes. So many people with diabetes have problem with their nerves, including neuralgia. The excess glucose in the bloodstream may damage nerves. This damage is most common in hands, arms, feet, and legs. And the less common causes of neuralgia, let's talk about them. So if the cause of neuralgia isn't infection, isn't multiple sclerosis, if it's not diabetes, if it's not any kind of compression or any kind of pressure in the nerves, so it may be from one of many less common factors, and this include chronic kidney diseases or medications prescribed for cancer or any kind of antibiotics which are used to treat some type of infections, and if there is any kind of trauma, any kind of injury such as from surgery. And another cause of neuralgia is also chemical irritation. So this is the basic etiology, and these are the leading causes of neuralgia. Post-herpetic neuralgia in an elaborated manner in brief. So let's talk about this, and this is the main topic of this presentation, this video. So as we have already talked about what is post-herpetic neuralgia, let's talk about it in an elaborated manner. So post-herpetic neuralgia is a painful condition that affects your nerve and your skin. It is a complication of herpes zoster virus, which is also called as shingles. Shingles is a painful blister, skin rash which is caused by reactivation of a virus which is also called as varicella zoster virus, which people usually get in childhood or adolescence as chickenpox. The virus can remain dormant in your body's nerve cells and after childhood and can reactivate years later. When the pain caused by shingles doesn't go away after the rash and blisters clear up, the condition is called post-herpetic neuralgia. Now next we'll talk about what are the clinical features, that what are the signs and symptoms of post-herpetic. Typically causes a painful blistering rash on your body. And the post-herpetic neuralgia is a common complication that only occurs in people who have already shingles. And the common signs and symptoms of post-herpetic neuralgia include severe pain that continues for more than 1 to 3 months in the same place that the shingles covered, even after the rash goes away. Secondly, burning sensation on your skin, even from the slightest pressure. And another symptom is sensitivity to touch or suffering from neuralgia, whether they are suffering from post-herpetic neuralgia or not. So these are the leading tests if you want to diagnose whether you are suffering from neuralgia or not. So And which type of test to use based on whether an outbreak is present or not. If you are experiencing what you believe to be herpes outbreak, your doctor can use a viral culture test or virus antigen detection test. So here are the various tests which we will discuss one by one. So the first one is viral culture test. So this test is used to determine if a sore contains the herpes virus, and this test can sometimes produce a false negative, meaning that it may not detect the virus even though it's present. And the second test is virus antigen detection test. This test is used to determine if antigens to the herpes virus are present in a sore or lesion. And the third test is antibody test. If you are not experiencing any outbreak but yet still believe you may have been exposed, so you can opt to have an antibody test performed. This test will only show a positive result if the antibodies to the virus has been developed. Therefore, this test isn't necessarily recommended for recent exposure. The last test for post-herpetic neuralgia or any type of neuralgia is PCR, that is polymerase chain reaction test. So with this test, a healthcare provider can screen a sample of your blood or tissue from a sore. They can use this to determine if herpes simplex virus is present and which type you have. So these are the various investigations that you can perform if you have any doubt that you are suffering from herpes simplex virus or any kind of neuralgia, especially post-herpetic neuralgia. So the very important part of this presentation, that is management. So if you are suffering from any kind of neuralgia, so how you will manage that? So let's talk about the management. So here are some natural treatment for shingles. So following bath. So daily cleaning of the blister reduces the risk of spreading the infection. Take a cool bath or shower to soothe the skin. The coolness of the water can ease pain from shingles blister and calm itchiness. You can also take a healing bath to reduce symptoms. Pour 1 to 2 cups of colloidal oatmeal or cornstarch into lukewarm bath water and soak for 15 to 20 minutes. And don't use hot water. Hot water can worsen shingles blisters because heat increases the blood flow. So this was all about the first natural treatment, that is healing bath. Now second, wet cool compress. Let's talk about it. So in addition to taking a bath to relieve pain and itchiness associated with the shingles rash, apply a cool, moist compress. Do this several times throughout the day to relieve symptoms. Soak a cloth in cool water and wring out the water and apply the cloth to the rash and the blister. The coolness of the compress can reduce the pain. Repeat the procedure as often as you need and don't apply an ice pack to the rash. The coldness may increase skin sensitivity and worsen the pain. Now the third test, baking soda and cornstarch paste. Let's talk about it. So create a paste using cornstarch or baking soda and water to naturally relieve itching caused by a shingles rash. Pour 2 parts cornstarch or baking soda into a cup. Add 1 part water to get the desired consistency for the paste. Apply the mixture to your rash and rinse it off after 10 to 15 minutes. Repeat several times a day as you need it. The last one is dietary remedies. So let's talk about it. A weakened immune system worsens shingles. Some dietary changes can strengthen your immune system and prevent shingles from spreading to the other parts of your body. Take steps to boost the functions of your immune system by eating certain foods and avoiding others. A shingles diet consists of foods with a vitamin A, vitamin B12, vitamin C, and vitamin E, and some kind of amino acid lysine. Foods that promotes healing include orange and yellow fruits, leafy green vegetables, red meat, eggs, chicken, wild-caught fish, dairy products, whole grains, legumes, beans, tomatoes, and spinach. As you heal and cope with the effects of shingles, you might crave comfort foods. However, you should avoid certain foods if you have shingles. So food to be avoided included food and juices which contain high amount of sugar. Second, arginine-rich food, including chocolate, gelatin, and nuts. Next, refined carbohydrates, and the last is food which is high in saturated fats. Eating too much of these foods can weaken the immune system and potentially prolong the virus. Food with high level of arginine can even cause the virus to reproduce. So these are the some management part, natural treatment which you can do if you are suffering from post-herpetic neuralgia. And in the next video we will discuss about how one can treat any kind of neuralgia, whether it's post-herpetic neuralgia, whether it's glossopharyngeal, or whether it's trigeminal neuralgia. So how you can manage, how you can treat it with homeopathic medicines. So that's all. So that's all for today. See you guys in our next video. That is how one can treat post-herpetic neuralgia with homeopathic medicines. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. Stay safe, stay healthy, and don't forget to meditate, exercise every day, at least for 3 hours. And yes, thanks for watching our video.